Hello guys, welcome back to my channel. If you are here for the first time, welcome. So before we get started, make sure you like, comment, and share, and hit that subscription button so that you will be notified of my latest videos. Alright, so we know that the digestive tract starts from the mouth and ends at the anus. The digestive tract serves to break down food for digestion, absorption, and elimination. First question, where does digestion start to take place? If you said mouth, you are correct. So we start breaking down carbohydrates in the mouth with salivary amylase. That carbohydrate starts breaking down into simpler sugar. So digestion begins with the act of chewing, in which the food is broken down into smaller particles that is being swallowed and mixed with digestive enzymes. Absorption, that is a major function. If we are breaking down the food but it's not being absorbed, it serves no purpose. So absorption is the major function of the small intestine. Vitamins and minerals are absorbed in this part of the digestive tract. So elimination occurs once your food has been broken down, digested, and then it has no more use to the body, or the body has used what is needed to function optimally. So you eliminate out the waste product. Enzymes found in the different parts of the digestive tract. So you have your saliva and salivary amylase found in the mouth. So this helps to chemically break down the food. However, the mouth also helps to mechanically break down food. Gastric function, you can find your hydrochloric acid, your pepsin, and intrinsic factors. This again helps to chemically break down the food. In the small intestine, you can find amylase, lipase, trypsin, and bile. So these are made in different parts of the body. For example, the bile is made by the liver and stored in the gallbladder, but this is where the secretions go. So in the small intestine, you will find your amylase, your lipase, your trypsin, and your bile. So your lipase is used to break down fat, while your trypsin is used to break down protein. So assessment of the gastrointestinal system. Remember that whenever you're doing this assessment, it's a focused assessment on that particular area. So you're going to focus on your characteristics of pain, onset, duration of any pain or any changes that person may be experiencing. Most importantly, you have to ask a patient or a client about their regular bowel movement. With that, you have a baseline to see if the patient is getting better or getting worse. Common sites for referred abdominal pain. With this, I will leave a link in the description below in order for you guys to have a visual of what it looks like. Some common assessments that you may find with the gastrointestinal system. So the first one is dyspepsia, aka indigestion. So indigestion can be caused from many things, such as overeating or eating too quickly, eating a lot of food that is high in grease and fat, spicy food, smoking, or even emotions like anxiety. So definitely you have to pay attention to when your symptoms started and what could be a triggering factor. Another assessment that may be noted is intestinal gas, so bloating, distension, and feeling full. So this can be caused from gas-producing foods. Some examples: cabbage, egg, broccoli. These foods are these are gas-forming foods. So if a person is experiencing a lot of intestinal gas, they want to avoid foods like these. Another assessment that can be noted is nausea and vomiting. There's a lot of factors that can cause nausea and vomiting. Certain foods, certain emotions, again. So you definitely want to pay attention to these factors that may contribute to an increase in feeling nauseous or what can trigger vomiting. Another assessment, changes in bowel habits and stool characteristics. One most important tip: the shape of your stool will tell you information about the shape of your colon. So if there's something going on in your colon, you can basically assess the stool, the shape of the stool, and see what's going on. If you have a blockage, you might have noodle shaped stool. If you have constipation, you may have more liquidy stool, and it's not that the stool is liquid, but that's the That's the waste that can pass through that blockage. So definitely pay attention to the shape of the stool, the characteristic of the stool. For the oral cavity, you definitely want to pay attention to the lips, the gum, and the tongue. So especially underneath the tongue, make sure you check underneath the tongue because cancers can form under the tongue. Any lesions that are noted that weren't usually there, you have to pay attention to it. And also, 2 weeks is the cutoff point in which if you notice a lesion and it's growing or it's not getting better, then you know that there's something going on. If after 2 weeks it's not changed and it is progressing, say for example, you might have a lesion in your mouth. Sometimes you may be eating and you accidentally bite your tongue or your gum. You have to pay attention to these lesions also, because if they are having delayed healing, that can signify different problems such as maybe diabetes. That's a slow wound healing. If a person has diabetes, if a person has something like herpes, you can note that. You can note lesions in the mouth, stuff like that. So you definitely have to pay attention to the oral cavity. For the abdominal assessment, you definitely want to use the 4-quadrant method when assessing the abdomen. You first start in your lower right quadrant, then you work your way in a clockwise position. So lower right, upper left, then lower left. And that is how you would do your assessment. Now, please pay attention to this. When doing your abdominal assessment, the first thing you should do is inspect. After inspection, you auscultate, percuss, and then you palpate. So there is a reason for this. The reason why we do this is that we want to cause the least amount of manipulation while doing this assessment. So when you inspect, you're only looking, so you're going to pay attention to if there's any lesions on the abdomen, if it's bilaterally even in color. For auscultation, as I said, you're going to start with your right lower quadrant, and the maximum amount of time you will spend in each quadrant is 5 minutes. Once again, the maximum amount of time you will spend in each quadrant is 5 minutes. And you assess in a clockwise manner. When making this assessment, you can notice normal active, hyperactive, or hypoactive bowel sounds. When you are percussing the abdomen, you might note tympanic sound, and this is usually noted over gas-filled areas. Now, whenever you eat and the intestines are filled with fluid or with food, you may note a dull sound. So definitely pay attention to these different sounds. And for your last one, palpation. Whenever you palpate, you want to palpate systematically. So you start again from your right lower quadrant, work your way up and around. Definitely you want to always make sure that the patient has voided, because upon palpation, if they have a full bladder, it can be uncomfortable for the patient. So definitely you want to make sure that they void before you start this assessment. So again, the order in which you assess the abdomen is inspection, auscultation, percussion, then palpation. Diagnostic tests for the GI system. So you may have your serum laboratory studies, you may have your stool tests, such as your fecal occult test. You may have a breath test like your urea breath test to check for H. pylori bacterial infection of the GI system, abdominal sonography, genetic testing, image studying, upper and lower tract studies. So I will definitely go into these as we go along. So for endoscopic procedures, anytime you see anything end in scopy, you know that they are visualizing this area with some form of scope. So for example, colonoscopy, proctoscopy, you know that they are definitely using some form of scope to visualize that area. For GI motility studies, it's right in the name. It is exactly studying the motility of the gastrointestinal tract. An example of this is a test called esophagogastroduodenoscopy. So this test is endoscopy, right? It's gonna actually use a scope in order to visualize the gastrointestinal tract. So the scope is entered into the oral cavity, and it goes all the way down into the duodenum, the first part of the small intestine. So this can also detect if you have any polyps, if you have peptic ulcer, if you have any gastric ulcer going on, anything that may be abnormal. This is a test that they may use in order to see what's going on inside your GI tract. Alright, please keep in mind whenever you're going to do any diagnostic testing on patients, you have to make sure that they are aware and knowledgeable of exactly what is going to be done to them and that they consent to it. You know, this is going to be a invasive procedure, and so they need an informed consent. Remember, nurses do not obtain informed consent, they only witness informed consent. With that said, I hope you guys enjoyed this video. Make sure you like, share, comment, and subscribe. And if you have any questions or any concerns, anything that you want me to clarify, you can definitely leave a comment down below and I will get back to you guys. Once again, thank you, all the best, and good luck.